I know many people are interested in the forthcoming plan for vaccination of children who are ages 5 to 11. As Executive Summers mentioned, not only is this important for their health, but it would help mitigate the impact of COVID on schools, quarantines, etc. They will receive a smaller dose of the Pfizer vaccine, but it's the same basic vaccine, same principle, and good safety and efficacy in the clinical trials. Moderna and Johnson & Johnson have not yet applied for extension of their emergency use authorization to include children. Given concerns for patient safety and logistics, the mass vaccination clinics operated by the health district will continue to focus on initial vaccination for adolescents and adults and boosters for eligible booster recipients of all ages. Vaccination for children under 12 years will not be available through these sites. This again relates back to safety and logistics and following consultation with area pediatricians and a general consensus that somewhere under age 12, it no longer is really medically appropriate or feasible, we think, to vaccinate kids in a drive-through setting, and they really need to be in a seated setting that's a little more amenable to the special needs of younger kids. It's not like just vaccinating a tiny adult. There's a whole different set of issues there, as well as using this vaccination opportunity wherever it's possible to help the child get up to date on other missing vaccines and catch up on any out-of-date well child care.
For the layman, can you explain why it would be inappropriate to have 5 to 11-year-olds come to mass vaccination clinics? Is there a concern that this decision could slow down youth vaccination uptake?
Well, first do no harm. That's one of the things in medicine, but also it's just yes. I mean, younger kids often aren't excited about getting vaccinated. Although I think more kids, I've heard, older kids more excited about this vaccine than any other. Those who are aware of what's going on and the benefits it could bring them in their life. But still, in general, kids tend to duck out and often need to be, sometimes get a little more tender loving care, or, calm, quiet, holding to keep them still. And also there's that, and that's just not amenable to doing something in a drive-through setting. Also, you've got the parent to deal with, not just the vaccinee. And often that's, counseling and having them help you. And that's just, again, this is not a good setup for a drive-through situation. And, it's really best done on firm ground. And, that's the general consensus of the pediatric care providers that I discuss this with, including vaccine experts. Reasonable minds may differ, but that's the way we're going, safety first. And also, you mentioned, if there is a lot of chaos involved often in that with younger kids, and then if you have that going on in a string of drive-throughs, it's really going to cause bottlenecks. So it's just not a good setup for that. I don't really think that it should substantially diminish the pace at which we get this done. It's just going to be done through different venues.